Welcome. I'm Mike Devo from International Medical Massage. I have an office in St. Charles, Illinois, and this is part 5 of our Stay Safe at Home series. Lot now that people can't get in the office to see us, I'm trying to do some tips at home that you can try and help yourself out before you come in to see us. So today we're going to talk about trigger finger, and also how trigger finger can lead to Dupuytren's contracture. If you've seen the commercials with John Elway talking about that. So trigger finger is a something that happens with repetitive motion. If you're doing a lot of computer work, or someone that's using a nail gun or carpet, anything that you're doing over and over and over again, you're going to get a form of trigger finger. So I've made this little drawing on my hand. This is basically the palmar aponeurosis that comes out of your wrist and goes up to each finger, and each tendon group has its own connective tissue and fascia, part of the skin. So what happens in the case of a trigger point or repetitive motion, this area starts to get tighter and tighter, because if you're doing repetitive motion and you're not fully extending each time, this area gets shorter and shorter and shorter. And in the case of Dupuytren's contracture, the collagen fibers start to connect with the skin and the fascia, and you'll start to see a little bulge here. And if you stretch this will pop right out. You'll see it. So what we want to do is avoid that at all costs. Unfortunately, once it's a full-blown Dupuytren's contracture, the only solution is surgery, but medical massage is a good help afterwards to keep all that scar tissue broken up so it stops from reforming. So like anything else, when I talk about whatever we're doing here, anything usually starts from the spine. So in this area, we would probably be working the area of C6 to T2 to 3 in your back, and we would start out there first. And everybody said, why are you working on my back? It's my hand. Well, everything comes out of the spine, all of your nervous system. So we either want to calm down or activate that nervous system, depending on what we're trying to do. So we would do a little bit back there, and then, let me wash this off here. We would work on the forearm itself. I'm using a little CBD massage oil here. So we would work the whole arm down, specifically on the forearm, leading into the hand, working on the back, working on the front, working through the carpal tunnel area here. And I didn't talk about the thumb, because that's a whole separate issue. We'll get into that with a different video. So you want to work along that palmar aponeurosis first. Try and get that area to loosen up. And again, this isn't going to work miracles here. This is just if you're having issues, and something you can do at home while you can't get in to see us for a full protocol treatment. So you can go across. You can see I'm going across that area for each finger, each different finger. And depending on which one you're having the issue with, that's the one you're going to want to work most with. And you can work all the way up to the finger. You can also get out the trusty little massage ball I have here, and this isn't a hard surface, but you'd want to work that palmar aponeurosis there back and forth with the ball and follow it all the way up to that finger. You can also work the ball in between the fingers as well on the tendons in between the joints. It's a little tricky and it takes practice, but this is a point in time where we've all got a lot of extra time on our hands, and so this is a good way to put it to practice. So again, that's just a little tip, something you can do at home to work on those trigger fingers, and after each time you can do some passive stretching. Do the whole hand. You can do each individual finger. And again, on a hard surface, you can do some isometric stretching. First stretch this way, and then what you want to do is try and push your hand like into the table for 10-15 seconds. And then after you do that, then you can do your passive stretching. Take a deep breath, exhale, and do those stretches. It's not a lot, but hopefully it's something that a little bit that can help you out till you come in to see us. Again, I'm Mike Devo, International Medical Massage, and thanks for watching.